Dr. Fazzolino, I've got a patient in exam room 4 that I wanted to run something by you and get your opinion on. It's a 22-year-old African-American female that's in with pelvic pain today. Now, she's had a history of this over the last few months, ever since she had her Implanon implant put in for birth control. And since that time, she's had irregular menses, irregular bleeding, and abdominal pain and pelvic pain as well. She did refer back to her gynecologist after this began, and her gynecologist did an examination on her. Everything checked out normal there. She was tested for gonorrhea and chlamydia, and both came back negative. There was no significant fibroids. Her urinalysis at that time was also negative, and her white blood cell count was normal as well. So they couldn't seem to significantly find out what was going on with her. She did come to us in December, and everything checked out fine then as well. The only difference that I saw between then and now is that her blood pressure was slightly elevated today. She was 128/68 back in December, and today she's 155/67. Now, she denies any social history. It could be contributing, any stress, no activities of any kind that could be contributing. Could be the fact that she actually is having so much discomfort from it that's causing it to be elevated, but just wanted her to keep an eye on that and reassess when as needed. I decided to do a head-to-toe assessment on her at that time and just check her out, see if anything was abnormal, as well as a pelvic exam. Her vital signs checked out fine except for her blood pressure. She currently has no allergies and there's no medications as well. Her cranial nerves all checked out fine. She's alert and oriented ×3. Her lungs were clear. Her heart rate is regular rate and rhythm. She moves all extremities well. Pulses are all good. I did progress to the pelvic exam at that point, and just when I inserted the speculum, she had a lot of discomfort in her pelvic region. I looked at her cervical eyes, everything looked fine there, except she did have a little bit of purulent discharge coming out. I decided to swab that and do a smear on it just to see if anything came back from that. I also performed a bimanual exam on her to see if that brought up anything, and there was nothing conclusive with it. After the examination was done, I had her go do a urinalysis again, and also decided to draw some labs on her to reassess her white blood cell count. On the smear, I didn't see anything conclusive there. There was nothing evident. The urinalysis came back negative, and her white blood cell count was normal again. So my diagnosis that I was considering at the time, vaginitis was number one, largely due to the fact that with the Implanon implant, it can predispose a patient to vaginitis. So if that were to be the possibility that is causing all of this discomfort for her, it would be necessary for her to return to her gynecologist and have that removed. I was considering UTI, but since the urinalysis came back negative, that obviously ruled that out. The only other thing I could think of was a possible pelvic infection, and maybe pelvic inflammatory disease. With the white blood cell count being normal, I decided to proceed with her treatment plan based on pelvic inflammatory disease, largely due to the classic symptoms that she was displaying. She had her cervical motion tenderness, she had annexal tenderness, and also had abdominal and pelvic tenderness. So with those three signs, that seemed like the most logical type of treatment to provide for her. So we decided to give her a Rocephin shot today here in the office, 1 gram IM. And then I started her on doxycycline hycolate, 100 milligrams PO BID for 14 days to see if maybe that resolves some of the issues that she's having, and then have her come back in at the end of that regimen 2 weeks from now and reevaluate her. But other than that, I couldn't think of anything else, and I wanted to see what suggestions you might have.